This is FaceOff with Anita Kapoor, the talk show with insight and bite featuring amazing people doing audacious things. Coming at you live from the 938 Live studio every Thursday and Saturday. And this is my last program for the season. So it's befitting that I have the honour of welcoming to the program the founder of BodyTalk, Dr. John Veltheim. BodyTalk, you're asking? Perhaps the fastest growing wellness modality in the world. BodyTalk seems esoteric and strange to some, yet is spoken of with wide-eye wonder by others. Is it just a fad? Is it real? Why bother? We're going to talk about energy fields, self-healing, and is this the key and the missing piece in our overall wellness and lives? Dr. John Veltheim is a chiropractor, traditional acupuncturist, philosopher, Reiki master, lecturer, amongst many, many, many things. He is also the creator of the BodyTalk System. He ran a very successful clinic in Brisbane for a number of years and was also the principal of the Brisbane College of Acupuncture and Natural Therapies. His postgraduate studies include applied kinesiology and, interestingly, theology. To tell us everything about himself and how he came to discover and devise this system, John Veltheim, founder of BodyTalk, welcome to Face Off.
Thank you. It's lovely to be here.
Now, when you ask practitioners of BodyTalk to explain the system, most people are lost around about the idea of consciousness-based system and body's innate healing abilities. In the simplest terms, describe BodyTalk.
Well, I think the first thing we have to overcome is the fact that most alternative systems tend to be modalities, such as applied kinesiology, and they tend to be something that can fit into other systems and a bunch of techniques that you can use. But BodyTalk over the last 15 years has evolved into a profession, and that's now been recognized as such, because now next year many universities in the world will be offering undergraduate degree courses in BodyTalk. And the reason for this is that it is a total profession in so much as we have BodyTalk pediatricians and BodyTalk neurologists and BodyTalk gynecologists and BodyTalk physical therapists. We have sports medical specialists and psychologists, etc., all practicing and utilizing the BodyTalk system. So when you talk about consciousness-based and innate, the key that differentiates BodyTalk from the other systems is that BodyTalk is scientifically based, as opposed to any other healthcare system at the moment, according to people like Dr. Amit Goswami and James Oshman, very famous authors and scientists, because BodyTalk is based on quantum theory and dynamic systems theory, which are the pure sciences, versus Cartesian modeling. And what that's really saying is we're looking at the whole picture when we look at a condition. If you come with an ulcer, we're not concerned about just diagnosing an ulcer and deciding what we can try, and if that doesn't work, we try something else. In BodyTalk, we gather all the details as to all the emotional background of that ulcer, the environmental factors that have occurred, dietary factors, spinal factors, and so on. There's a huge spectrum of things. And once we've established that, then we work out a treatment protocol. Now, the key element, of course, is how do you establish that? And that's where we move away from the traditional diagnostic system, because the traditional diagnostic system is very, very limited in what you can come up with, because the average, no matter how much diagnosis you do, and I've done every system, medical, non-medical, Chinese, you name it, you can only get an educated guess based on a few symptoms. So what we've acknowledged, and as in quantum physics, is that there is an innate wisdom, an innate consciousness that's within the body. And if we can learn to work with that and actually literally ask it questions and get information by training our intuitive processes to be highly accurate, which you can, then the body can tell us in detail what is going on and guide us in what is the appropriate course of therapy, whether it be natural therapies or even surgery.
That's a lot to take in, actually.
Yes.
Don't you feel, though, that some traditional therapies, Eastern therapies like Ayurveda and traditional Chinese medicine, do actually take into consideration all of these factors, your emotions, your diet, where you live, where you come from?
No, and I've studied them all. And I've taught most of them. They try to. their goal is to, when you talk about holistic medicine. But let's face it, acupuncture is still Cartesian because it's studying just one system. It's like doctors can become a kidney specialist or a heart specialist, an acupuncturist is a meridian specialist. And we like to, I remember, I was head of a college in naturopathy and acupuncture and all that, and we used to think that we were holistic. But the fact is, we needed to ask questions. But if we're looking at your history, we can't find that out unless your body tells us tells it to us, not accurately.
To talk more about what your body is saying, we're going to keep on talking to Dr. John Veltheim after these messages. FaceOff with Anita Kapoor continues, and we have the most amazing gentleman in the studio, Dr. John Veltheim, who's telling me that my body is talking to me, as everyone's body is talking to them. Before we carry on with that idea, though, was it an aha moment for you? Where were you and what space were you in a particular spiritual or esoteric space when this all came together for you and you realized this is happening, there is nothing out there to treat all of this and I'm going to do it?
Actually, it was through a personal crisis of my own. I had worked extremely hard for a long period of time and I ended up very sick. And I was in hospital with a very advanced Epstein-Barr virus. The doctor said that I'd lost 90% of my liver. My enzyme count was 1,300 when it should have been 40. They estimated I had 2 days to live. And I said, well, what treatment are you going to do? And they said, we don't have treatment. You're going to be dead in 2 days. So at that stage, I decided, A, to reevaluate my lifestyle, and 2, check myself out of the hospital.
Very quickly, with just 2 days.
Now, at first in those days, I used Chinese medicine, herbs, acupuncture, meditation. And I meditated like 20 hours a day. That got me out of the crisis. But I was then left with a chronic Epstein-Barr condition. And I traveled the world at that stage. I ended up selling my clinic and decided to do other things. And traveled the world looking for a cure. And after several years, I wasn't finding one. I was left with this severe chronic situation. And it came down to it, I had to work out a way of doing it for myself. And so the first thing I treated was myself and got results. And from there, I developed it, using my background and knowledge, into looking at the different principles that were based more on because although I did all the medical studies, I had a fairly deep background in philosophy, Advaita Vedanta philosophy, and particularly quantum theory and dynamic systems theory. So starting to combine those with my medical background, I was able to put together this system which has evolved in the last 15 years to now a profession.
Now, does a person need to be in a crisis situation, or do they need to be in a particularly spiritual or esoteric environment in order to understand and appreciate body talk and the principles?
No, because I think I'm pretty good at interpreting them. In a short interview like this, I can't, but you give me a little time.
Well, we can do another hour, Jack. That's no problem.
The principles really make just common sense to people. It is common sense that your body should know how to heal itself. It's common sense that your body is talking to you all the time. That's what symptoms are. When you get pain, or if you eat some berries in the bush and you start throwing up, that you won't start eating those berries again, because you'll say, my intuition is telling me that they may be poisonous. Yeah. So all the symptoms in that are the body talking to us. And what we found is that we can simply extend that and actually ask for information, and there's a protocol we can do that with high accuracy. In fact, I get tested by lab results and x-rays before and after, and I outperform the MRIs and x-rays in accuracy of what's going on in the body. Yeah.
This is pretty much blowing my mind, actually, John, because you're explaining it in such a succinct way, and I feel I can actually grasp and understand it. But is this then to say this is the missing piece in wellness, but not just wellness, but in the medical world? Because don't you think doctors and medical practitioners have just stopped listening to the body, and they just listen to the symptoms?
Well, it's very seductive to have very expensive instruments and massive tests and sophisticated surgeries and things like that. And there are times when they're critical. If I'm in a serious car accident and my head's been chopped off, I actually want a surgeon to sew it back on, not a body talker. right? But I still want a body talk practitioner to make sure I recover properly. And so there is still a very important role in medicine, particularly what I call first aid therapy. But when it comes to really getting into the nitty-gritty of what health is and why we are sick and what is actually going on, so that we can bring about changes that are lasting rather than symptomatic and first aid, then we have to look elsewhere. We have to take in a much bigger picture. And this is occurring because in the world of biophysics, for example, brilliant people like James Oshman, who's written books on energy medicine, he's on my advisory board of my college, for example. And Dr. Goswami is speaking out and writing on Body Talk. Bruce Lipton is writing on Body Talk now.
Yes, energy medicine
all these famous people.
Completely acceptable now.
It is acceptable. Yeah. It's been acceptable in half the world for 5,000 years, given China.
Yes, absolutely.
And India.
Yes.
But Body Talk is not just energy medicine. We consider it more than that because we're working on the mental level, the energy level, and the physical level. And so we take it even a step further than energy medicine. But you could say it's state-of-the-art as far as all that goes.
What is the best use of Body Talk? What is it useful for diagnosing and coming to terms with?
We cover the whole spectrum. Body Talk, we use it for virtually anything that you'd go to a doctor for. I think that the reason we got such a big name so quickly would be our very good results in things like allergies, because that's something that most people have a lot of trouble with.
Absolutely.
Food intolerances and allergies and things
so
like that.
So widespread, yeah.
And chronic viruses, chronic bacteria and things like that, leading to fibromyalgia and chronic fatigue.
Yes.
In general, that's something medicine doesn't tackle well, and it's very, very common. And quite frankly, we've found that when we get the body to target the particular problems and we unearth what is actually going on there, and the body will tell us, we can get the body to very specifically target that chronic virus or that chronic bacteria or parasites and things like that and clear them up. And often people with severe fibromyalgia who are almost bedridden can be out of bed within 2 or 3 days.
Fascinating stuff. When FaceOff continues, we're going to talk about the criticism around Body Talk with Dr. John Veltheim.
938 Live.